Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then long posterior ciliary arteries. Long posterior ciliary arteries are also two in number. These long posterior ciliary arteries can be either nasal or they can be temporal, and these will run in the suprachoroidal space and they reach the ciliary muscle, and in the ciliary muscle they anastomose with each other, and they also anastomose with the anterior ciliary artery to form a major arterial circle, which is also called as circulus arteriosus major. So they anastomose with each other and the anterior ciliary artery to form a major arterial circle or circulus arteriosus major. So if you see the same picture now, here there is an anterior ciliary artery. This is the anterior ciliary artery. This is the long posterior ciliary artery. Long posterior ciliary artery will also be in two in number. One we have nasal and the other we have temporal. So it will run in suprachoroidal. This is the choroid. Above the choroid, the space present above the choroid is suprachoroidal space. So this long posterior ciliary artery runs in suprachoroidal space and reaches this is the ciliary muscle. It reaches the ciliary muscle. In the ciliary muscle, it will anastomose with the anterior ciliary artery and it forms major arterial circle, or also called as circulus arteriosus major.
thank you and thank you for watching.